Well, it's Thursday, and joining us now is In Focus Health correspondent Linord Moudou. Hi,
Hello,
Linord.
Dimiaki.
What do you have for us today?
Well, today we will be talking about female genital cutting or circumcision. It is a common practice in parts of Kenya. The procedure involves removing part of or all of the external female genitalia and is typically performed on girls as a rite of passage. Critics call it female genital mutilation or FGM. In the town of Meru, Eastern Province, the Catholic Church has come up with an alternative for girls and young women. Cathy Martinier reports.
A group of grandmothers demonstrate how to serve food and which herbs to use to cure specific ailments. They are teaching the next generation the secrets of womanhood, like their mothers and grandmothers before them. These girls and young women in the Meru area of Kenya are going through traditional training of how to be a good wife, mother, and woman, but with a difference. At the end of the process, they have a graduation ceremony and receive a certificate, rather than undergo a procedure in which part of their genitalia is removed. The modified traditional training, called the Alternative Rite of Passage, is a project of the Catholic Diocese of Meru and Catholic Relief Services. Coordinator Martin Coombs says the project aims to eradicate the harmful practice of female circumcision while preserving local culture.
Today is a graduation ceremony for the girls. There will be songs and dance. The rhythm, the dance, the way it is done is like the way it was done in the past. But you see, the messages have been changed to reflect what you would like the girls to learn currently.
Girls and young women in several locations across the Meru Diocese spend 1 week away from their families in what is called seclusion. They are taught lessons on anatomy, human rights, the dangers of drug and alcohol abuse, HIV/AIDS transmission and infection, how to relate to their peers and parents, and other life skills. Marian Waria is a retired banker who is one of the volunteer teachers in the Alternative Rite of Passage, which is usually held 2 or 3 times a year.
And we teach them the taboos which Momeru used to have, that they are told when you are not circumcised, you cannot be married. When you are not circumcised, you cannot get pregnant. When you are not circumcised, you are not a grown-up woman. But we tell them these are just myths.
16-year-old Justa Mwenda wants to be a lawyer. She says the training given during the 1-week seclusion has given her skills on how to express herself without fear and to stand up for human rights. She says she also learned a lot about the dangers of female circumcision.
And I will try my best to see that my children or our children are not circumcised. I will even help those uneducated parents and tell them about these dangers of FCR so that my intimates or my friends will not be circumcised.
Female circumcision is illegal in Kenya. In communities that continue the practice, school dropouts, marriages of girls as young as 12 years old, and early childbirth can be consequences of female circumcision. Bernard Gituma is a member of the Meru Council of Elders, a body concerned with maintaining Meru culture.
Most of our daughters who did not go through the circumcision, most of them have gone through schools, even to the universities. They are happily married. But those who went to the circumcision very early, they got married very young, and their lives have not been improved.
Justa Mwenda, her peers, and her family say the Alternative Rite of Passage is a ticket to an empowered life. Cathy Martinier for VOA News, Meru.
The rape of women and young girls is common in some conflict areas of Africa. President Obama condemned the practice and violence against children last week during his speech in Ghana.
It's the death sentence of a society to force children to kill in wars. It is the ultimate mark of criminality and cowardice to condemn women to relentless and systemic rape. We must bear witness to the value of every child in Darfur and the dignity of every woman in the Congo.
And women in eastern Congo have long suffered the crushing burden of rape during war. I talked with Nita Evele, an activist from the DRC and a member of the Coalition of Pluralists and Congolese Patriots, COPPAC. It is a Washington-based organization that advocates for Congo.
The issue of rape in the Congo, it's not even a rape anymore, because when you look at the way it's been done and the way it is perpetrated, it's to really inflict pain and suffering to those women. They're doing that so that they can punish the whole community, punish the women, and punish the whole and bring the whole community down.
What are some of the experiences that you've heard coming from these victims?
Most of them, after being raped by 15, 20 men, some of them have been shot in their private parts. Some of them has been burned in their private parts. Some of them have just been cut in pieces, had their children cooked and eaten. It's just an unbelievable, evil way they're doing to really bring those people down.
Let's talk about some of the health consequences.
Mm-hmm. We've seen increase in HIV, increase in sexual transmitted disease, increase in all kind of infection that's not healing because there's no antibiotics or anything to help. We had the biggest issue with the babies. Some of the women had babies after being raped, and those babies have nobody who cares for them. Frankly, I don't think most of the babies received the love and care that any other baby had, because every time those mothers look at those babies, they feel the pain.
What are some of the cases that you've seen that has happened to women after they're being raped?
They become somebody else's problem. That means most of the NGOs working in the Congo help take care of them. But how long is it going to go? Those women need to go back to their life, have a little bit of psychological follow-up or something that will help them take care of themselves. And I think for a long time, all they've been asking is peace. Can they have peace and security? And maybe if we find solution for those rebels to go home too, maybe by having that peace or the fact to know that there's no that big threat for them anymore, they might go back to their life, to livelihood. Because, like you know, in Africa, there's no psychiatrists or psychologists to kind of help people overcome their problems. But the community played that role. For our hospital, like the Panzi Hospital and Heal Africa in both Kivus, who are doing that. I think in Panzi Hospital, they have one psychologist, and at Heal Africa, they try to have women create a community where they help each other, talk about what happened to them so they can have a relief.
Well, that's your health report for today.
Heartbreaking.
Very much so.
But thank you for bringing that to our attention.
Sure.
Of course, that's Linord Moudou of In Focus's health segment. She joins us every Tuesday and Thursday right here on In Focus.
And for more information on these stories, go to voanews.com.